We will talk about teeth grinding, which is known as bruxism also. It's a very common condition. Teeth grinding affects around 15% of children. It's more common among boys, usually aged 6 to 12. Now let's say, what is the most common causes of bruxism? It can occur during sleep period and wakefulness also. During wakefulness is more common. Most common and most important factor for bruxism is stress. In 40% of cases, it is caused by stress. Stress can be because of home environment, social challenges, or school pressure. So any type of stress can cause bruxism in kids. And parents often searching important disease or important causes of bruxism, but usually it's because of stress. During stress hormones are released, such as cortisol, adrenaline. They cause increased tonus in muscles, and especially when whole body control is weak during sleeping time, kid can grinding his or her teeth, and it's common condition. Stress release and decrease of stress is management at this case, and prognosis at this case usually is good, because as a person getting older, his condition will improve, and when you decrease stress, this condition becomes easier over time. Second most common cause of teeth grinding is pinworm infection or parasitic infection or worm infection. But this issue is not clear totally. It's debatable topic because we have no strong evidences, but we have some anecdotal states and some observational studies, and they say that pinworms causes bruxism, and it's maybe partially true, but we have no strong evidences here. And what's the explanation? Explanations are only hypothesized, and it means that person is restless during sleeping time because these worms comes out around anus and they irritate skin, and this irritation can cause teeth grinding. It's one explanation. We have another explanation, which means that toxins which are released by these worms affects and irritates nerves, and it causes contraction of muscles in the jaw, and it causes bruxism. But these hypotheses are not confirmed, and no direct correlation and no strong correlation is observed. That's why we can say definitely, but it's possible that there is some correlation between pinworm infections and bruxism. Especially we have several studies. According to them, around 40% of kids who had bruxism were infected with pinworm also. So there is some correlation, but we don't know this is true correlation or false correlation. Another cause of bruxism is teething. In 50% of cases, when new teeth emerge from gums, it causes discomfort, irritation, and maybe unconscious response to alleviate this discomfort is teeth grinding and bruxism. So around 15% of cases happens because of teething, especially in young children. Another cause of bruxism is misalignment of teeth. It's also a common condition, and uneven distribution of force creates pressure on certain teeth or certain muscles, and it can trigger involuntary grinding. That's the idea. It's compensatory grinding or compensatory contraction of muscles to compensate the imbalance. That's the idea at this case, and at this case misalignment correction is required. Also, some medication can cause teeth grinding, such as antidepressants, antipsychotics also some conditions like attention deficiency and hyperactivity disorder can cause bruxism, and bruxism over time can damage tooth and gums. That's problem, of course. That's why we need to management it, and mouth guard and splinters are most commonly used to manage teeth grinding, and they are effective. And of course, treatment and management of underlying cause is important also. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.